Chase, hey dude. I figured this would be an easier way than typing it all out, so I tend to talk a lot, so I just figured I'd do it this way. There's no guarantee that this phone isn't gonna fall, so FYI. Okay, so how does corrective exercise differ from other methods of injury prevention? The way that I explain it to people is that if you go see a chiropractor, they're going to work on the skeletal system. If you go see a massage therapist, they're going to work on the muscular system. But none of the practitioners and anybody that's doing injury prevention, they don't look at the nervous system and how the nervous system is sending signals to different muscles. So it differs because of the order that we do it in. We always start with either shutting down the nervous system or activating the nervous system. So we shut down the nervous system first, then that breaks up adhesions and turns off or inhibits the muscle from firing. And then we lengthen. So once we take the knots out, then we can stretch. And then we neurologically send the signal to the weaker muscles so that the weaker muscles can fire and get stronger, because if they're constantly fighting neurologically, if they're constantly fighting the dominant muscles or the overactive muscles, then they're only going to get 20% activation. So it differs than other methods of injury prevention because we actually start by working on the nervous system first. Is there a certain point where overcorrecting your body can cause backlash? Well, you've seen it. There are very few clients that actually experience a shift in their posture, but let's just say you start with somebody who's quad dominant. So their pelvis is supposed to sit neutral and it turns into what we call an anterior pelvic tilt. If I have them on a quad dominance program and they're lengthening their quads and strengthening their hamstrings, if they do that too much and they miss an evaluation and they continue to lengthen the quads and strengthen the hamstrings, the pelvis is going to sit back in neutral, which is what we want. But if you do it too much, it can actually create a posterior pelvic tilt, which then is hamstring dominance. Same thing with the chest. I mean, we never ever see rhomboid dominance, but it can happen with outer to inner shifts, like you've had that asymmetrical weight shift, and also front to back shifts. What is the difference between physical therapy and corrective exercise? This kind of goes back into injury prevention, the first question that you asked, because physical therapy tends to try to get multiple people in for rehab at the same time. So you walk into a physical therapy office and Sally's getting massaged and Joe's on the arm bike and Susie's getting having exercises done, and so they really just tend to put you wherever they can fit you. But because the way that the body works, the nervous system sends a signal to the muscle to contract, the muscle contracts, and then the skeletal system moves, you have to start with the nervous system. So there has to be some sort of inhibition or muscle relaxation provided first in order to have the full benefit of corrective exercise. So it's different than physical therapy because of the order that we do it in. We also look at each individual body as their own entity. We don't treat just back pain and just foot pain. We have to look at Chase's biomechanics and say, okay, well, Chase has an asymmetrical weight shift to the right, his left adductor is weak, his right piriformis is too tight. So we have to go through and look at every individual body instead of just treating one symptom. What is the goal of corrective exercise? What is it trying to do to your body? We're trying to maintain balance. So if there is, we call it structural integrity. So structural integrity, you could think of it as a bridge. If the structure is sound, the pyramid, the foundation of the pyramid is sound, then everything above it is going to be fine. But as soon as that pyramid starts to crumble or the foundation starts to crumble, then all of a sudden the layers above it are unstable. And so we're trying to locate, address, identify imbalance in your body, whether it be in your big toe or your neck or your wrist or your elbow, because everything is connected. So we're really trying to treat everybody as an individual and trying to bring you back to being more structurally efficient. Will your body maintain your corrections you have made? No, it absolutely won't, which is why it's a maintenance. So if you lost 100 pounds dieting and exercising, if you didn't maintain that diet and that exercise regimen, then you could gain the weight back. And it's same with corrective exercise. So and I know that you know from experience, but if you have done a corrective exercise program for back pain and then your back feels good and then you start playing football again and all of a sudden everything starts coming back, pull out your program, you do your program again, it goes away, your body's going to adapt to your environment. So just because you treat something one time doesn't mean that it's gone forever. Just like dieting, if you diet, for 4 weeks and you lose 10 pounds, it doesn't mean that can't come back. Is this a growing practice? Are more people using corrective exercise? Yes. And here's the cool thing about corrective exercise is it's actually right now, it's mainly in professional and collegiate sports. When I started 10 years ago, nobody had heard of it. It was only the Phoenix Suns because Aaron Nelson and Michael Clark. The Cardinals, a lot of the teams out here in Arizona were using it because NASM is Arizona based. But now there's over 100 professional and collegiate teams using Fusionetics alone and also incorporating corrective exercise because they've found that corrective exercise is kind of more efficient than physical therapy. Not to say that physical therapy isn't efficient, it's just that everybody's body is so different, and physical therapy has all the right modalities, but they don't do it in the right order, typically because they're trying to turn over a high volume of patients. So it is a growing practice. More people are using it, but it's not readily available to the public yet by many people. Like, there are a lot of personal trainers that are corrective exercise certified, but they don't apply it or know it or use it like I do. So finding people that are have a specific niche in corrective exercise, you can definitely find them. They're just few and far between right now. But it would be a great field to get into. If you learned this as a physical therapist now, you would be way ahead of your game. Does age impact the efficiency of corrective exercise? Yes and no. And I say yes and no because of this. So if you're, because you're younger, but if you're 12 years old and you had, you played sports and you got injured or whatever, you have adhesions. Those adhesions have only been there for like a year, right? If you're 70 and you've never got a massage, you've never foam rolled, you have adhesions that have been there for 50 or 60 years. So the level of the adhesions, it's going to be higher, they're going to be worse than somebody that's like 12 or 13, but it's still effective because the body responds the same way. The only time we see, a struggle with clients that are older or people that are fighting inflammation, virus, bacteria, things outside of just muscle imbalances. But then I say, no, it doesn't affect the efficiency because like if you take somebody that's older, they've kind of been around the block, and especially like one guy popped into my mind, but he was 75 and he had plantar fasciitis for 15 years. And it only took him 3 weeks to get rid of it completely because he did the program twice a day for 3 weeks because he was retired and he didn't have anything better to do. So he did it. And so it can impact it because the adhesions have been there longer. Their bodies aren't going to bounce back as quickly. They don't heal as quickly as we get older. And we're typically not as active. So what can cause corrective exercise not to be successful? Not doing your program. It's not going to work if you don't do it. I tell people all the time, I could give you a diet, but I can't feed you. I can't cook for you. I can't go grocery shopping for you. I can't sit by a bar and say, don't drink that, don't eat that. So it's not effective if you don't do your program consistently. Regular protocols about 3 to 5 days a week. It's also not effective if you don't do it in the right order. So let's just say I give someone a program and it's roll, stretch, activate, integrate. And they roll in the morning, stretch at their lunch break, activate before they work out, and then work out. It's not effective. You have about a 45-minute window where you have to complete everything back to back. So I think that covers all of the questions. But if you have any other questions, just feel free to let me know, okay? All right, thanks, buddy. Good luck.